A parliamentary inquiry has been launched looking at the impact of long COVID and repeated COVID infections on Australians and the health system. Joining us live now is Dr Mike Freelander, Labor MP and also chair of the committee. Mike, good to see you. Appreciate your time. Thanks for coming in.
Thanks for having me.
What do you want to achieve? What do you want to get to at the end of this? What do you want to know?
Well, we want to have some solutions for government going forward, because COVID's not going away. And we believe, or I believe, that long COVID and recurrent COVID is having significant effects on our health system and our economy, and will continue to do so for the foreseeable future. And we need to plan how we're going to tackle this, how we're going to get people equitable access to care, and what issues should we be concentrating on. Many of my medical colleagues telling me, and there's lots of anecdotal evidence, that because of the inflammatory response from COVID, there are ongoing health issues, things like cardiovascular disease, neurological disease. Many people are ending up with symptoms that go on for weeks and months, and at least 5 and possibly more than 5% of people who contract COVID are having these ongoing issues. And we need to be able to deal with it and make sure that we are doing the best thing possible to keep people in touch with medical services, and if there are treatments available, getting them access to those treatments as soon as possible.
Do you worry that there is a gap in the data in terms of long COVID? We don't seem to have a whole lot of information about that. And reinfections, I don't think we're actually recording reinfections. Do we know how many people have actually had 2 or 3 rounds?
Well, we're seeing reinfections, and we are keeping some data on that, but it's certainly by no means complete. With long COVID, it's pretty clear it's a pretty heterogeneous disorder. In other words, people are getting all sorts of different symptoms, all sorts of different inflammatory responses. We don't even have a real definition of what is long COVID. And we certainly need to clarify that. We need to see if there are any markers, any screening tests we should be doing to pick up people with long COVID. And we also need to be looking at what are the risk factors for long COVID. We know that people, for example, with diabetes are more likely to get severe disease and ongoing symptoms. People with already pre-existing cardiovascular disease seem to be getting more prolonged symptoms and more severe disease. So we need to look at all this data and collect what information we can, and more is being gathered all the time, so that government can work out some ways of dealing with this continuing health problems from the pandemic. COVID's also not going away. I mean, we're getting at least 4,000 or 5,000 cases a day.
And those are the ones being reported as well.
That's exactly
right.
What
about children? Because your background is as a paediatrician. Does it keep you up at night? Do you worry that children who might have had a mild infection at the time will suffer perhaps years down the track because of a COVID infection they had as a child? I'm
extremely worried about this. We know that COVID infections are causing evidence of inflammation in children that is ongoing. I've seen some really terrible looking x-rays from children who've had long-term lung damage from COVID. And whilst most children get over their COVID infections pretty quickly and pretty well, there are some that are getting continuing symptoms. We need to know if there is anything we can do to, number one, screen the children that are at risk and provide ongoing surveillance for them. And there aren't many services available in that respect. And governments are going to have to tackle this problem. State governments, federal governments are going to need to know what to do, how we can get services to people, not just in the inner city, but out of metropolitan, rural and regional areas. How do we get access to services for those children and those adults with long COVID? And how long should we be following them for? What sort of tests should we be doing? There's some evidence accumulating of very subtle but definite myocardial damage from COVID infections. Should we be looking at kids in the longer term, and for how long? And the same as with adults.
So considering all those concerns that you just outlined, have we rushed it in terms of reducing the isolation period? Are you worried about that?
Look, it's a question that is only going to have a political answer. You need to weigh up all the advice and all the data and work out how we are going to get back to it.
But if you take off your politician's hat for a moment and speak from your medical background, do you think it's too soon?
I think we should be doing everything we possibly can do to reduce the number of infections we're having, but whatever we do, we are going to have a functioning society dealing with this. And so that I support the decision that has been made by the National Cabinet, because they have weighed up all the evidence. I think there are many different opinions about this, of course, and you can speak to 20 different epidemiologists and you'll get 20 different infections. By nature, I'm a cautious person, and I think we should be doing whatever we can to reduce the number of infections we're having, but I understand we also need to have a functioning society, and it's weighing up. Those decisions are always going to have political answers.
Sounds like you would prefer to see the 7-day isolation period staying in place.
You can interpret what I'm saying any way you like.
Yeah. What about vaccinations, 0 to 5-year-olds? At the moment, it's only the immunocompromised kids having access to that. Does that disappoint you? Would you like to see Australia getting on with vaccinating the youngest cohort?
Yeah, I would, provided it's safe and the data is there that it is pretty safe, that I think we should be immunising younger kids. And certainly, you know, unfortunately, we have seen some children die from COVID. They're mostly kids with disabilities, but you know, it is by no means just the flu or just a cold. It's a serious illness, even in children.
Dr Freelander, we're all going to be watching this inquiry with interest, and yeah, look forward to seeing what you come up with at the end. Thanks so much for sharing your time and expertise with us.
Thanks for having me. It's been great. Thank you.